All right, let's talk about something that gets swept under the rug way too often. Scanty periods. I'm talking about those super light flows that barely last a day or two. Now, some people might think, hey, that sounds great. Less mess, less stress. But here's the truth. A scanty period isn't always a blessing in disguise. Let's break it down. In medical terms, scanty periods, or hypomenorrhea, mean your body isn't producing enough endometrial lining or blood for a healthy cycle. Why does this happen? Well, there are a few reasons. First, low estrogen. Estrogen is the hormone that thickens your uterine lining each month. If levels drop, there's just not enough lining to shed. Then there's PCOS, polycystic ovary syndrome. It messes with ovulation, making cycles weak and unpredictable. Anemia or nutritional deficiencies are another biggie. If your body doesn't have enough iron or nutrients, it literally can't spare the blood for a full period. And don't forget about the thyroid, especially if you have hypothyroidism. That can shorten or lighten your bleeding too. And finally, there's premature ovarian failure, or perimenopause. As your ovarian hormones start to drop, your cycles get lighter and more irregular. Now, let's peek into Ayurveda for a second. In Ayurveda, scanty periods are called artavakshaya, which basically means your body's run out of menstrual blood. It's all about balance. Too much vata? It blocks the normal downward flow. Not enough pitta? You're low on blood tissue. Weak rasa and rakta dhatus? Your body just doesn't have enough supply to nourish a full period. Here's the bottom line. When your body's low on resources, whether it's hormones, blood, or nutrients, it prioritizes your vital organs. That means less energy and blood for your reproductive system. So why does this matter? Scanty periods aren't just lighter and easier. They can signal low fertility. Your body might not be ovulating properly, or there's not enough lining for an embryo to implant. It could mean poor blood or nutrient status, or a hormonal imbalance that needs attention. So when people say scanty periods mean your body's running out of blood supply, it's not just a saying. It's a sign your body needs help. Maybe more nutrients, maybe hormone support, maybe a check-in with your doctor. If your periods have suddenly changed, don't ignore it. Listen to your body. It's trying to tell you something important. Take care of yourself, and don't be afraid to ask for help if you need it.